everybody, I'm Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I'm going to actually take a little break away from some education regarding the business of medicine, and I wanted to talk about the monoclonal antibody treatments that are being used for COVID-19 patients. I am working with a clinic in Sweet Home, Oregon, and we have been awarded, I guess you could say, or selected to distribute the treatment of monoclonal antibodies to patients who are sick with COVID-19 or prophylactically for anyone who has been exposed closely to someone who is positive for COVID-19. I found out about this treatment option about 6 weeks ago. There was a webinar through the Oregon Health Association, or the OHA, and I watched the webinar, and we didn't think it was something that we would be able to administer at our clinic because we didn't have any RNs, and to our knowledge it was all IV. Well, due to the emergency use authorization for the medications and the trials they did administering them subcutaneously showed efficacy very close, if not almost the same, to IV administered medication, and the side effects and chances for an allergic reaction were still extremely low. So they decided to issue the emergency use authorization for subcutaneous administration. That definitely put us in the running because we have medical assistants and they are very well qualified and under their scope able to administer subcutaneous injections. It's definitely something we wanted to be able to offer to our community because it is underserved, it is rural, and we wanted to get our name out there because we're new. We just opened about 4 weeks ago, and we thought that would be a really great way to not only serve the community but also advertise. We were fortunate enough that we were selected in the first round, and we have been administering, I would say we got 24 doses the first time. We got 24 doses this last time. They arrived on Wednesday. So we have probably done a total of 32 doses now over the last 3 weeks. We have wonderful results. We have administered them to some people who have been extremely ill. There are only very easy qualifications in order to be able to administer them to folks. So you have to have a positive COVID-19 test, a BMI over 25, old age. It's not all of these that you have to qualify for. It has to be one of these, or COVID positive with one of these. Immune issues, so you could be immune deficient or have comorbidities that put you at higher risk to having higher or worse complications from COVID-19 infection. And also for people who have been exposed to somebody who has positive COVID and you're in a high risk range depending on your age, your health, whatever, and we can administer it then. Medicare and Medicaid are covering at 100% in Oregon. The Medicaid of Oregon is, and CMS is reimbursing at 100%. The reimbursement for the injection from Medicare is $420 for in-house and $750 if you were to go to someone's house and do an infusion or an injection. It's really nice money, and it's working really well in keeping people out of the hospitals, so that's wonderful. It's taking the strain off the hospitals and the staff there, and it's treating people at home. It is kind of a interesting process. It's 4 injections, so it's 4 2.5 milliliter or cc injections subcutaneously. So we're doing them in people's stomachs and behind their arms, any place that you can administer a sub-Q like insulin. And so it's high volume, but it's spread out and nobody has really complained about it. So that's a good thing. You have to monitor them for an hour after administration just to make sure that there are no allergic reactions or other side effects. And we need to make sure that we have the epi and the Solumedrol and anything else that we need to treat allergic reactions if we needed to. Commercial insurances, it's still kind of a toss-up whether they're going to cover it fully or if they're going to apply patient cost shares. It's just been within the last few months that a lot of commercial insurances have started applying patient cost shares to COVID treatments, testing, that kind of thing. I know they can't do that, or they're not doing that for the vaccines, but for testing, treatments, hospitalizations, office visits, a lot of the payer websites I go to now say that it depends on the patient's plan and that the patient should call their insurance to find out how their plan is specifically covering things regarding COVID. Of course, we would work out a payment plan for patients if they are responsible for a large balance, but we don't want anybody to get turned away. We're not paying for the medication. It is supplied totally free from HHS. So, we want to extend the services to our community and be as flexible as possible. The one that we're getting is Regeneron, and it's made by America Virgin, I think it's called, AB. But Roche is also helping manufacture because they're just trying to get it out so fast. And there's two different formulations. The higher formulation is approved in Europe, and we're just doing the 600 milligrams / 600 milligrams per 10 mils. So there's two different drugs in it, and I honestly would have to look up how to say the words because I'm really bad at saying all those monoclonal and biologic medications, but it is working really, really well, and we're very happy with it. We are just thrilled that we're able to offer this to people, and people have traveled from quite a ways in order to come see us to be able to get it. They're only allotting approximately 1,700 doses to the state of Oregon right now every week, and then the state of Oregon, the OHA, is responsible for divvying it out to people who sign up and ask for it. And in our area, besides the big healthcare entity that's in the area, we're the only private practice, and we're really easy to get into, almost like walk in, and if you qualify, we will treat you right there. So it's really nice. It's going really well. We're very happy with it. I don't think we've had anybody be hospitalized after we've treated them, from them progressing to the place that they need to be hospitalized. We had a gentleman who was extremely ill, probably the sickest person we have seen earlier this week, and to my knowledge, he is on the mends. It's slow, but he's definitely slightly improving, which we will take. So just wanted to talk about that. Super exciting. Not sure a lot of people know about it, but monoclonal antibodies is where it's at. If you become infected with COVID-19 and you're high risk, then I would definitely look up in your area where the closest monoclonal antibody treatments are. It has to be online. You can go to HHS, and I'll put the link in the description for the video so that you can go on and see where your nearest clinic is to see if they'd be able to assist you and treat you. So good luck. I hope this helps. It's just a little break from my everyday videos. So thank you so much, and stay healthy.